Hey everybody, happy Friday. Dr. Procter here with some answers to your questions. So I've been getting a lot of good questions sent in to me. A really good one that Lindsay sent in is, how do you decide which procedure is right for you? That's an outstanding question, Lindsay, and one that I'm really glad you asked, because it points out the fact that there's obvious differences in the many various bariatric procedures that we see out there. You might have heard the different terms of metabolic and non-metabolic procedures. Metabolic procedures being things like the sleeve gastrectomy, the gastric bypass, and the duodenal switch, versus non-metabolic procedures, which are categorized as lap bands, intragastric balloons, and endoscopic sleeves. So since I don't really do non-metabolic procedures, I'm gonna talk mainly about the metabolic procedures out there and the differences between them. It's an interesting shift that I've seen over the years that I've been doing this. When I first started doing bariatric surgery, sleeves were relatively new, and the main choices out there were either the lap band or the gastric bypass. Now, back in 2007, lap band was by far and away the most popular procedure out there, and as we all know, that's pretty much gone by the wayside. Now, we have the addition of the sleeve gastrectomy, which became very popular over the last 10 years. But again, we've seen sort of a shift recently back towards the bypass type procedures, the gastric bypass, the duodenal switch, and now the modified duodenal switch, or SADI, the single anastomosis duodenal ileostomy. So what's the difference? Why do we do all these different things? Why does it matter? Well, not one procedure is going to fit every patient out there. That's a really important thing for everybody to understand. I have a lot of patients that will come in the office and say, hey, my next door neighbor, my coworker, had a sleeve gastrectomy, so that's all I researched and that's what I think I want. To me, that's kind of like going to a mechanic and saying, my neighbor's car was acting up and they got their carburetor replaced, so I think that's what we need to do to my car as well. Maybe that's a little bit of a simplification, but and I don't really know anything about carburetors. But suffice it to say that it's important, as you're going through this journey, as you're doing your evaluation of yourself and whether or not this is right for you, that you really need to talk to a surgeon that offers multiple metabolic procedures. If you're in an office where a surgeon maybe just offers a single procedure, ask that surgeon, what if this procedure isn't right for me? If the answer is, well, if it's not right for you, I'll explain why, and I'll refer you to somebody else who maybe does a different procedure. If the answer is, well, that's nonsense, this procedure fits everybody, you probably need to keep looking, okay? So next video, we're gonna break down the procedures a little bit, and we're gonna talk about what the differences are and how we sort of categorize which patients may fit that procedure.